COVID-19 is the disease caused by a new coronavirus called SARS-CoV-2. It hits the world with pandemic since December 2020. Until June 5, 2021, the confirmed cases reported are 172,242,495 cases, including 3,709,397 deaths. COVID-19 cases rose significantly in Malaysia since March 2020, and total COVID-19 cases in Malaysia is 610,574 as of June 5, 2021. In the past 10 days, Malaysia broke new record which had average of 7,000 new cases per day. The death cases in Malaysia due to COVID-19 had break 3,000 cases as of June 5, 2021. What have Malaysia done to fight against COVID-19? Prime Minister of Malaysia, Muhyiddin Yassin, announced different types of MCO, which are MCO, CMCO, RMCO, and EMCO according to infection rate of COVID-19 throughout the pandemic. In March 2020, First Movement Control Order, MCO, was announced. Restrictions on movement included travel bans nationwide and international travel bans, except for residents returning to Malaysia. Crossing district and state were banned, except for vaccination, medical conditions, or with approval letter from PDRM. Gatherings for any purposes, whether religious, sports, recreational, social or cultural purposes, were prohibited. All educational institutions, including schools, colleges, universities, and kindergartens nationwide, were required to close. Residents only can travel within 10 km radius from own home for getting daily essentials or other activities that are allowed. Dining in is not allowed for all the restaurant. MKN encourage more on work from home and online learning. Sports are allowed for those involve single individual only. This MCO is similar with the FMCO that we are having right now. Enhanced Movement Control Order, EMCO, is a stricter type of MCO specific for location which have cluster that contribute to rising of cases to that area. Movement outside of homes are not allowed after 10 p.m. except for emergency cases or for those with a police permit. Only one person are allowed to go out from EMCO area for buying essentials. The entry and exit of EMCO area are guarded by Royal Malaysia Police. Other SOP are similar to MCO. Conditional Movement Control Order, CMCO, is similar to MCO but with loosened rules. The restaurants are allowed for dining in. Restaurants are required to arrange the table for 1 meter distancing. Crossing district are allowed. Education institutions are allowed for opening. Face-to-face learning is allowed. All these permissions should be practiced along with SOP. Recovery Movement Control Order, RMCO, have much more loosened rules than CMCO. This MCO is practiced when there are very low cases. A significant change included allowing travel from one place to any other place within Malaysia for work purposes, except to and from places which were under the implementation of the EMCO. In addition to the above, travel by air to and from Peninsular Malaysia and Sabah and Sarawak were allowed for work and supply of essential services. House visits and gatherings were also allowed for Hari Raya Puasa, Pesta Kaamatan, and Gawai Dayak Day celebrations. Tourism services were also allowed to operate. All these permissions should be practiced along with SOP. How Ministry of Health play a role in fighting against COVID-19. First, by standardizing SOP. SOP for all MCOs include mask wearing is a must when at outside. People should always stay 1 meter away from each other when at outside. Scanning temperature before entering any shops. People with temperature higher than 37.5 degrees Celsius are not allowed to enter. People should also scan QR code through My Surgitera app when visit any locations. 14 days quarantine but now changed to 10 days are enforced for those are close contact for COVID-19 positive cases and who are returned to Malaysia from other country. Second, Ministry of Health also had increased number of hospitals for treating COVID-19 cases. Ministry of Health had raised special fund which is COVID-19 fund that specifically for those have no income for treatment and quarantine and also for restocking medical supplies. In order to compensate the rising of COVID-19 cases, Ministry of Health had transformed MUPS into low-risk quarantine center for COVID-19 patients. Ministry of Health created special Facebook user account called Crisis Preparedness and Response Center, CPRC, and Kementerian Kesehatan Malaysia, KKM, to provide sufficient and up-to-date information to the publics through various infographics associated with COVID-19 such as post-COVID-19 syndromes and steps for close contact or symptomatic peoples. How My Surgitera app help in COVID-19 situation. The hotspot button help public aware on the risk of infection around their residential area/working area. By checking profile, it shows different status including low risk no symptoms, PUI and close contact. This will help public to know their status and prevent the spread of disease. It provides conveniences for Kementerian Kesehatan Malaysia to track on possible COVID-19 patients. COVID-19 vaccination in My Surgitera app help in register vaccination in a super fast way. It will also notify through the app when reach your turn for vaccination. Besides, it also provide information for FAQs regarding the vaccine. Ministry of Health highly encourage Malaysian to get vaccinations in order to achieve herd immunity. There are different types of vaccine but Malaysia offers only Pfizer, Sinovac, and AstraZeneca. Although we are unable to choose the types of vaccine, but no matter which vaccines we are getting, as long as it can break the chain of COVID-19 infection, it is an awesome vaccine. How government helped from economic aspect in COVID-19 pandemic. Economic Action Council meeting held announced the allocation of RM600 million to the Ministry of Health to battle COVID-19. Prime Minister, Muhyiddin Yassin, introduced Prihatin package which included an additional budget of RM1 billion to cater for medical needs, such as the purchase of equipment and services to overcome COVID-19. RM600 allowance for healthcare personnel and RM200 allowance to frontliners. RM10 billion allocation to fund B40 and M40 families under the National Caring Aid, Bantuan Prihatin Nasional. The government allows pre-retirement withdrawal from the Private Retirement Scheme, PRS, of up to RM1,500 without tax penalties. Free internet from all telcos from April 1, 2020 until the end of the MCO in 2020. RM25 million allocation in collaboration with NGOs to provide food and shelter for senior citizens, orang asli, and the disabled. Last but not least, thank you all the frontliners for always stand in the first line protecting us from COVID-19. Shout out to everyone, stay at home, get vaccinations. Protect yourself and your family.